across the country, really, that there is this concern that there's going to be more aggressive illness coming into the system.
Understanding the human cost of surgeries delayed during the COVID-19 pandemic. A Saskatchewan woman being treated for an aggressive form of face cancer here in Alberta, being told by her doctors she might have been able to keep her nose had they gotten to it on time.
If I could have had it done back in, say, April instead of waiting till October, I would definitely have a nose to reconstruct instead of having to go and get a full prosthetic.
54-year-old Sharon Durham faced delays, cancellations, and anxiety. Just getting that biopsy in spring of 2021 when she thought the cancer returned, her surgeon at the University of Alberta needed to fight for her to get the treatment as out-of-province care is halted. She had a date for surgery in September, but then she was one of the 15,000 people scheduled for surgery getting a call that it wasn't happening, postponed, as Alberta Health Services dealt with an overwhelming number of COVID-19 ICU patients, largely unvaccinated.
Maybe it doesn't affect you, but if you don't get that vaccine and end up in the hospital, it affects so many other people that you don't know. You just don't know who it all affects.
People get a glimpse of hope saying, oh, we're going to book your surgery. And then within hours before their surgery, they're already prepped and their surgeries were canceled.
Cara Soro is currently researching the impact of COVID-19 related surgery delays, expecting it'll be a long time until we get a full picture.
An undeniable physical component, but there is also a really significant mental health and the burden of the distress caused by these delayed surgeries on patients. And I would say that's probably the most universal across all patients, is that mental health component. And it is tied in also to their physical health.
Alberta Health Services says they can't put a date on getting back to full surgical volume, but they're committed to getting cancer surgeries back above full capacity soon. A spokesperson saying they understand the anxiety and frustration and know it's been difficult and challenging times. For Durham, her doctors are optimistic they got the cancer, but now hoping there won't be more delays when she's scheduled for her next procedure so she can wear a prosthetic.
We need to get educated about this vaccine because it's saving lives. It'll keep our hospitals uncluttered of people and being able to open it up to everybody again to get the surgeries they need.
In Edmonton, Carly Robinson, City News.